Hi, my name is Capogna. I'm a physical therapist here at Star Physical Therapy in Shelton, and I'm going to be talking today about upper extremity overuse injuries. An overuse injury is microtrauma or stress that occurs to bones, tendons, or ligaments. Some common examples are lateral epicondylitis or tennis elbow, medial epicondylitis or golfer's elbow, or little leaguer's elbow, which is an inflammation of growth plate in the elbow. Some common causes of overuse injuries are an athlete increasing their activity level too quickly. If an athlete has a muscle imbalance or a flexibility imbalance, that can also cause an overuse injury. And lastly, if they're not getting enough rest time between practices, games, and matches, that can also cause an overuse injury. Symptoms of an overuse injury typically start with some mild intermittent pain, and as the injury increases, the pain can become constant to the point where the athlete can have pain even while at rest. Typically, if the athlete develops pain, they should begin treating the symptoms with ice, over-the-counter anti-inflammatories if necessary, and if the pain persists for longer than 5 to 7 days, they should discuss their symptoms with their athletic trainer, their physical therapist, or their team physician. Some things that can be done to reduce the chances of developing an overuse injury are, one, making sure the athletes are warming up and cooling down properly, making sure that they're resting at least 1 or 2 days a week to allow for proper rest for their bones and tendons. Another thing that can be done is making sure the athletes are cross-training, avoiding playing one sport 3 seasons out of the year. In the case of baseball players, I think it's important that they participate in a rotator cuff or scapular stabilizer strengthening program throughout the course of the season to prevent or reduce the chances of them developing an overuse injury. So we're going to go through a series of 7 exercises, 3 TheraBand exercises and 4 dumbbell exercises that are all targeting the rotator cuff and the scapular stabilizer muscles. This is Becky. She's going to help me demonstrate some of the exercises. The first one we're going to do is TheraBand resisted external rotation. The athlete's going to place a towel under their arm to support the arm and to help to isolate the rotator cuff. The athlete's going to lift their arm up and out on an angle, like so, against the resistance of the TheraBand. Good. Ideally, the athlete should perform 3 sets of 10 repetitions of each exercise. The next exercise we're going to do is TheraBand resisted external rotation, but with the arm up at 90 degrees. So the athlete's going to stand with a staggered stance. Abdominal area is nice and tight. They're going to rotate forward, good, and then pull back against the resistance of the band. If there is someone available, they can give the athlete some support to the front and back of the shoulder to make sure that the arm is in the proper position. So the next exercise we're going to do is a TheraBand resisted diagonal pattern. So the athlete can stand on the TheraBand. They're going to keep their elbow straight and they're going to lift up and out on a diagonal, like so. Next exercise is what we call scaption. The athlete's going to stand with their knees bent, tummy tight, and they're going to raise their arm out on an angle, keeping the elbow straight. They can go slightly above shoulder height as long as that doesn't cause any discomfort. Becky is using 3 pounds here. These are small muscles that we're working, so a few pounds should be sufficient. So the next series of exercises we're going to do are all prone exercises. The athlete's going to be laying on their stomach. The first one is what we call a W. So with the elbows bent at 90, the athlete's going to lift up and pinch the shoulder blades together and then bring the arms back down. Again, Becky's using a 1 pound weight for this exercise. A few pounds should be okay with this. And again, 3 sets of 10 repetitions. Next exercise we're going to do is what we call a prone Y. So the athlete's going to keep their elbow straight and they're going to lift up and out on an angle towards the ceiling. And lastly is what we call a prone T. Again, the athlete's on their stomach, elbows are straight, and they're going to lift their arms out to the side, keeping their palms down, facing towards the floor. If these series of exercises can be performed 2 to 3 times a week during the season, that should reduce the chances of an athlete developing an overuse injury. Once again, my name is Capogna, physical therapist here at Star Physical Therapy in Shelton. Thanks so much for your time. Don't forget to check out our website, www.ct-ortho.com.